Hello, everyone, and welcome to Medicare. My name is Isabella, and I'm excited to help you understand Medicare, your options, and how to make the best decisions as you turn 65. Pause the video at any time to take notes. Now, let's jump in and simplify this process together. Let's start with Original Medicare. It's made up of Part A, which covers hospital services, and Part B, which covers medical services. But keep in mind, there are costs involved, and it's not all covered. We'll go deeper into this in just a bit. Not everyone pays the same for Part B. There are some exceptions based on income and Medicaid eligibility. Programs like QMB and SLMB help those with lower incomes. And if your income is above certain levels, you may be subject to an additional cost called IRMA. Some of you will be automatically enrolled in Medicare. If you're already collecting Social Security, you'll receive your Medicare card about 3 months before your 65th birthday, and $185 will start coming out of your Social Security check each month for Part B. If you're not collecting Social Security, you'll need to enroll manually. You can do this online, by phone, in person, or by mailing in your application. And if you go this route, you'll be billed quarterly. As an important reminder, your Medicare coverage begins the first day of your birthday month. You have two main options when enrolling: start Medicare the month you turn 65, or delay Part B until you retire, especially if you're still working and have employer coverage. Timing is key, and we can help guide you. Now, let's talk risks. Original Medicare doesn't cover everything. You're still responsible for deductibles, co-pays, and co-insurance. That's where your next big choice comes in: Medicare Supplement or Medicare Advantage. Now, let's explore the difference between Medicare Supplement and Medicare Advantage. These are the two paths you can take to cover the gaps left by Original Medicare. Both have pros and cons depending on your needs. Let's break down your choices. You've got two routes. One is Original Medicare plus a supplement and a Part D plan. The other is Medicare Advantage, which combines everything in one plan, but comes with some trade-offs. Medicare Supplement gives you the lowest out-of-pocket costs. You can see any doctor who accepts Medicare. No referrals needed. You'll need to buy a separate Part D prescription plan. It's flexible and reliable. Medicare Advantage often includes prescription coverage, but comes with higher out-of-pocket costs and more restrictions. You'll need to use in-network doctors and usually get referrals. It's convenient but less flexible. Here's option 1 laid out clearly: Original Medicare plus a supplement and a prescription drug plan. You build your coverage with strong flexibility. The supplement, often called Medigap, helps pay your out-of-pocket costs from Medicare. Then you add a Part D plan from a private company to cover your prescriptions. Again, without a supplement, Medicare leaves you exposed to some big costs. That's why we always talk through how to cover these gaps with you. When should you enroll in a supplement? Ideally, 6 months before your 65th birthday. That's when you can lock in rates and avoid underwriting. Also, plans are standardized. Plan G from one company is the same as Plan G from another. Plan G usually costs between $100 to $200 a month, depending on your zip code and insurer. We help you shop and compare to find the best rate. We work with all the top carriers: Aetna, United Healthcare, Humana, Mutual of Omaha, you name it. We're unbiased and help you pick the right plan, not just push a specific company. Plan G covers everything except the Part B deductible. Plan N is a little cheaper, but has copays for doctor visits and ER visits, plus something called excess charges. We'll help you figure out which fits you best. Here's the whole picture for option 1: Medicare, a supplement, and a prescription drug plan. This setup offers maximum flexibility and coverage. Part D plans vary, and we walk you through the process of comparing and choosing the best one for your prescriptions. Important warning: if you don't enroll in Part D when you're eligible, you'll pay a penalty that lasts forever. It's 1% for every month you delay. Quick recap: you pay $185 per month for Part B, then choose a supplement like Plan G and a Part D plan. This gives you comprehensive coverage with flexibility and control. Option 2 is Medicare Advantage. Medicare Advantage plans combine Part A, B, and usually D. It's an all-in-one alternative to original Medicare. You can enroll during your initial enrollment period around age 65, or during the annual election period from October 15th to December 7th. New coverage starts January 1st. Let's compare one more time. Supplements give you flexibility and lower out-of-pocket costs. Advantage plans are convenient and may include extras like dental or vision, but often come with more limitations. Key takeaways. Original Medicare includes Part A, hospital, and Part B, medical, but leaves gaps in coverage. You can enroll automatically or manually depending on your Social Security status. Medicare Supplement, Medigap, has a higher monthly premium, low out-of-pocket costs, nationwide coverage, and a separate Part D plan. Medicare Advantage has lower premiums, higher out-of-pocket costs, local networks, and often includes Part D. Plan G is the most comprehensive Medigap plan available to new enrollees. Avoid the Part D penalty by enrolling on time. Timing matters. The best time to enroll in a supplement is 3 to 6 months before turning 65. At Casa Arteaga Insurance, we provide free, unbiased help to find the best plan for your needs. Call us today at 972-842-4716 to review your Medicare options.